Hello and welcome back to my channel Dedicated Dentist, where we probe dentistry 32 reasons why. We discussed activator, its construction, mechanism of action, H&V activator. This video will be talking about trimming of activator, which can cause dental movement. After the activator has been carefully evaluated for proper fit in patient's mouth, approximate trimming is then carried out. The acrylic is trimmed selectively according to the occlusal needs. Let's say we gave this patient an activator and has proclined upper incisors. So we'll remove acrylic or trim away the acrylic from the lingual surface of incisors. And an active labial bow is used. Active, that is, it is in contact with the surface of teeth, so that this active labial bow can apply force on the teeth in distal direction, and that will help us achieve retrusion. Also, we trim the acrylic from behind the surfaces of incisors, that is lingual surface. So there's this space behind acrylic to accommodate the retruded incisors. Similarly, we can correct protrusion of incisors, we can move teeth in sagittal plane, we can correct intrusion or extrusion of incisors or molars. So we can bring about dentoalveolar changes with the help of this. Thus, we can also correct dentoalveolar open bite and deep bite cases. Deep bite is when there's excessive overlapping of the mandibular anteriors by the maxillary anteriors. That means the incisors here are in supraocclusion, that is, they are supra-erupted. So there are different modalities to correct the deep bites. Either we can create the intrusion of upper and lower incisors, or we can extrude the upper and lower posterior teeth, or we can do the combination of these two. We can even procline the incisors, or we can go for orthognathic surgery. The decision whether to intrude the anteriors or extrude the molars depend on certain factors, which we'll discuss in the management of deep bite video. But for now, you need to know what intrusion is. That is, we are taking the tooth partially into the bone, as these incisors are supra erupted in deep bite, so we'll take them inside. So we can either intrude the incisors or extrude the molars, or do the combination of these two. Then open bite. Open bite is there's no vertical overlapping between the upper and lower anterior teeth. Since there's this open bite or space between the upper and lower incisors, what we are going to do, there's no overlap, so we are going to extrude the incisors. That is, we are going to take these incisors down so that there's normal overchin and overbite. For open bite, we are going to do opposite for what we did in deep bite. That is extrusion of incisors or intrusion of molar. Usually in open bite, there is this posterior premature contact taking place. So we can intrude the molars and call extrusion of incisors to correct the open bite. We also discuss about this extrusion and intrusion, how it is carried out with the help of bite blocks or bite planes. Make sure you watch that video of bite planes and Catalan's appliance in my orthodontics playlist. Now, trimming of activator for intrusion of incisors. We did intrusion of incisors in deep bite cases. So how we're going to do is we're going to place the labial bow incisally, that is below convexity in maxilla. Then you can see this acrylic is loaded between the incisal of edges of the upper and lower anteriors. So because of this acrylic that is loaded on the incisal edges, the forces, they will be directed apically by the acrylic, so that there will be intrusion. Hence, the deep bite will be corrected. Second, trimming for intrusion of posteriors. Now, in the posteriors, only the cusp tips, they are loaded with the acrylic. We do not place the acrylic in the fossas and fissures. They are free of resin. Again, this produces intrusive forces on the posteriors, and then they intrude or go inside. Now, trimming of activator for extrusion of incisors. Remember, we did extrusion of incisors in open bite cases. Since there was this open space between the incisors, there was no overlapping. So we wanted to take the incisors down or extrude them. So the acrylic is loaded above the area of convexity in maxillary anteriors, as you can see here in the diagram on the lingual surface. Then some space is kept between the teeth and the acrylic for extrusion. And the labial bow is placed in the gingival third. Whenever we want to extrude any tooth, we place the labial bow in the gingival third. And the acrylic is loaded below the area of convexity in the mandible. In case of extrusion of posteriors, the acrylic is loaded above the area of convexity in maxilla and below the area of convexity in mandible. If we are treating deep bite by causing extrusion of posteriors, intrusion for in, extrusion for outside. Trimming for protrusion of incisors. Here the acrylic will be loaded on the lingual surface of teeth, because we want to protrude the teeth. We want to bring them in front since they are retruded. Here the labial bow is passive, that is, it is kept away from teeth. This screens the lip strain, that is, it is keeping the forces of lip away from the teeth, because we want to protrude them. So it keeps soft tissue away from teeth and helps us achieve protrusion. Now, trimming the activator for movement in sagittal plane. that is mesial movement or distalization. So if we have a class 2 case, we'll cause the distal movement of the maxillary buccal segment. So we are going to load this acrylic on the mesiolingual surfaces. So this is indicated in class 2 non-extraction cases. Now for mesial movement, the distolingual surfaces are loaded by the acrylic. This is indicated for the upper arch in class 3 case. To bring about movement in transverse plane, the acrylic will be loaded on the lingual surfaces of teeth. So with this we can achieve expansion, but the movement achieved by trimming of activator is to a limited extent, and we need combination of therapies to correct any malocclusion. So that was all about trimming of activator. You just need to be well aware with the names of modifications of activator. Just enumerate the names.